Today we'll be discussing the evaluation of a patient with a positive hepatitis B virus result. Most of the times, the patient might be sent to the clinic probably during a pre-employment screening, probably during an antenatal screening. So they'll give them a referral note to be seen in the gastroenterology clinic. So when they come to you and you are asked to collect this patient, how do you go about it? First, you need to ask, when was the test done and where was it done? When and has it been done before? If it was done before, ask if it was positive or if it was negative. You need to ask about that. Then following asking that, you need to ask about the symptoms about hepatitis B virus infection. When you are asking for symptoms related to hepatitis B, you need to ask for a history of malaise, fatigue, fever, muscle or joint aches. That's very important. Any issue of nausea, feeling of vomiting. Then you also need to ask any issue of jaundice, passage of dark colored urine, passage of pale stools, right upper quadrant pain or abdominal pain. Then you also need to ask for issue of pruritus, which is body itching. You must ask. Now, you know this patient might come to you without symptoms, but you asking makes the examiner understand that you know what you are doing. Are you getting me? Then, having asked all those symptoms, let's say they are not there. You tell you in your clicking, no history of this, no history of that, you've done that. Now, the next thing you want to move to is talking about the risk factors and possible etiology. So, hepatitis B is transmitted through body fluids such as blood, semen, vaginal fluids, okay? And also even the vertical transmission from mother to child. So you need to ask any issue of blood transfusion. Not necessarily recent, any issue of blood transfusion, especially transfusion with unscreened blood products. Any issue of organ transplantation, sharing of sharps, are you getting me, among family members, and even intravenous drug users. At times you see in a family, they use different bleeds, they use the same bleed. That's a risk factor for contracting hepatitis B virus infection. Also, history of scarification marks, tattooing, yes, body tattoos. Those are risk factors for contracting hepatitis B. Any prior history of needle pricks, that's a key thing. Then the occupation of the patient is very key because health workers are at risk of this. So you need to ask any exposure to any needle prick. And also it's also contracted to sex. So unprotected sex with multiple sexual partner, even sex with a high risk partner is also a risk factor. Then you also need to ask for hepatitis B viral status of the family members. Okay, then if the patient knows, okay, yes, the hepatitis B virus status of the relatives or the siblings, are you getting? That one is also important. Now, you also need, there are some other questions you need to ask too that are actually important in evaluating a patient with positive hepatitis B virus results. You need to ask for the use of alcohol. Yes, because alcohol is dangerous to the liver. Use of alcohol, drug history. You need to add, some drugs are hepatotoxic to the liver. So beyond clicking the risk factors, there are some things that also contribute to the damage of the liver. Then another thing is you need to know the retroviral, the HIV status of the patient. That is also very important. Ask any family history of liver malignancy. It is also very important. Now, having asked all these questions, you need to move on to asking for complications such as weight loss, right upper quadrant pain, anorexia. When you're asking questions like this, you're actually suspecting, oh, is it likely this hepatitis B has transformed to hepatocellular carcinoma. That's a key thing. Then features of upper GI, you need to ask any melena, any hematemesis, hematochezia, you need to ask. Easy skin bruising or bleeding gums, that's also very important. You need to ask questions like that. Any history to suggest gynecomastia, loss of libido, or alteration in the menstrual cycle. Then another thing is they could have hepatic encephalopathy. You need to ask all this. You need to ask questions like reversal of sleep pattern. That's, normally we sleep at night, but then we find them sleeping during the day. Somnolence, confusion, loss of consciousness. Some come down with seizures. It can be that bad. Now, having talked about the complications, after you do your review of systems as you usually do, then you talk about care so far. Most of the times they've sought care from other places. They've treated malaria, they've treated typhoid, but no, it's not typhoid. Now, next is key things you are looking on examination. On general examination, jaundice is a striking thing you're expecting to see. You're seeing jaundice, weight loss. The patient might be cachexic. I'm not saying your patient in the clinic will have these symptoms, but I'm just telling that these are the things you should look out for. You're looking out for jaundice. Are you getting me? You're looking out for weight loss, like is this patient cachexic? Is this patient chronically ill looking? You're also looking for hysterexis, which is flapping tremor. Okay. Then beyond that, body generalized any pedal edema, you can also see that in them too. Then beyond that, you are looking for, okay, when you get to the hands, you can see things like palmar erythema, dupuytrenal contracture, leukonychia. Okay. Then on the body itself, you can see spider nevi. Those are things you should look out for, and even gynecomastia. If you go down, testicular atrophy, you can see that in them. Then one key thing is look for scratch marks. Because of cholestasis, they could be itching. Those are the key things you should be looking out for. Then going to the abdomen, checking for abdominal swelling. Checking for abdominal swelling. Are you getting me? Any periumbilical, dilated anterior abdominal wall veins, caput medusae. You are looking out for all those ones. You are looking out for hepatomegaly. You are looking out for splenomegaly. Are you getting me? Also looking out for ascites. Now, your abdominal examination is not complete until you've done a digital rectal examination. And in a digital rectal examination, you could actually find melena stool, or you can even find hematochezia. So I think I've talked a bit about the key things, at least, which you should see. Then their head too is important. It could be fluffy, which is showing hypoproteinemia. It's okay. What else again have I not said? Okay. And now, from beyond about the liver. The liver could be enlarged or it could be small. Yes, depending. It could be enlarged or it could be small. And okay. Let me move on to the evaluation. To the investigation. So now, how do you investigate such a person? You ask him. First thing is, before you start talking of other investigations, like other ancillary investigation, to start with, this patient came with a positive hepatitis B result to you. So start from there. So you want to, if possible, you want to repeat the test again. You want to do anti-HCV, that's antibody for hepatitis C virus, because there might be co-infection. Then you also want to check the retroviral screening of this patient. Then after that, you also want to request for hepatitis B panel. An hepatitis B panel consists of the hepatitis B surface antigen, the antibody to the surface antigen, the hepatitis B envelope antigen, the antibody to the envelope antigen, then the antibody to the core antigen. Okay, and this actually has a lot to do in the management of the patient. Okay, then you also need to quantify. And how do you quantify? By requesting for hepatitis B viral load. You need to ask for that. Then you also need to request for the liver function test. That's from the bilirubin, the total conjugated ALT, AST, ALP, GGT, the albumin, total protein. You need to ask for all those things. They are very important because the arrangement in some of these biochemical parameters could explain that, oh, the liver cirrhosis has started to set in. Then you also request for serum alpha fetoprotein, check for or request for PT INR, prothrombin time in time, then the INR. Because one of the complications of chronic hepatitis B virus infection is when it conforms cirrhosis, patient can come down with coagulopathy. So you need to investigate that. Are you getting me? You need to know the baseline of that. Then you need to request for the full blood count. One thing that is key in the full blood count is the platelet count. Yes, a low platelet count is a marker, or I would say it suggests that liver cirrhosis are setting, and this patient is if not careful, will start manifesting features of coagulopathy. Then you also need to request for an abdominopelvic ultrasound scan. Then there's another one they call the transient elastography. Okay, then though it might not be for the level of students, but there's something they call the FIB4 scan and the APRI index. Those are things that you also might know. So those are the key things you need to know. I've talked about the history. In the history, we talked about the risk factors, the symptoms, the risk factors, the complications, then your key findings on examination, then how you investigate. So probably in subsequent videos, I will discuss how you interpret the hepatitis B panel. So you can do well to drop your comments if you have any questions or clarification. Ensure you share this video, ensure you like this video, and ensure you subscribe to my channel for more medical content. Thank you.